There is something happening in your living room right now, probably at this exact moment, that most people over 60 have no idea is quietly working against their heart. And the frustrating part is that it looks completely harmless. It looks like rest. I want to talk about this carefully because the subject gets sensationalized easily, and that helps no one. This is not a warning that one afternoon on the couch will send you to the emergency room. That is not how biology works. What I am describing is a slower process, the kind of gradual, cumulative physiological stress that most people never feel until the damage has already been building for years. The kind of thing a cardiologist sees in a 68-year-old patient and thinks, this did not begin last month. So let us work through this honestly, because there are actually 3 distinct sitting patterns I want to cover today. And the one most people think is the safest turns out to be the most dangerous. I will get to that one last, because once you understand it, it changes how you think about the other two. Before we get there, let me establish something important. For years, medicine treated physical inactivity and prolonged sitting as essentially the same problem. The thinking went, if you are not moving enough, you need to exercise more. But research has now shown that sitting is actually a distinct risk factor, separate from a lack of exercise. That distinction matters enormously if you are over 60, and I will explain exactly why as we go. The first sitting pattern I want to address is the one that seems the least alarming, but has the most immediate effect on your vascular system. It is the one you probably do every single day, multiple times a day, without giving it a second thought. It is simply sitting still for too long without moving, not in a dramatic, collapsed posture, just sitting. Normally, in a chair, for hours. Here is what is actually happening inside your body during that time. During sitting, increased hydrostatic pressure within the leg vasculature causes blood to pool within the venous circulation. Your legs are below the level of your heart, and without muscle movement, the blood that flows down into them has a much harder time getting back up. Without regular muscle contraction, the veins struggle to pump blood back to the heart, causing venous stasis, a condition in which blood pools in the veins, particularly in the legs and feet. In a 30-year-old, this is a minor inconvenience. The body compensates quickly. But after 60, several of those compensatory mechanisms have quietly weakened. Vein valve function declines with age. The muscle pump that normally squeezes blood back toward the heart when you walk or shift your weight becomes less efficient. So the blood that pools in your lower legs sits there longer, the pressure inside those veins builds, and the cardiovascular system has to work harder to compensate. A 2024 study published in the American Journal of Hypertension found that just 3 hours of uninterrupted sitting significantly increased blood pressure variability in healthy adults. This matters because beat-by-beat fluctuations in blood pressure can be an early sign of blood pressure problems, even before someone develops full-blown hypertension. And here's the part that should really get your attention. Research shows that each additional hour of sedentary behavior per day results in a small but measurable increase in diastolic blood pressure, the bottom number on your reading, averaging about 0.66 mmHg. While that might not sound like much, it is clinically meaningful because higher diastolic pressure is independently linked to increased risk of heart failure and cardiovascular death. What the cardiovascular system does not respond to is events. It responds to patterns. One afternoon of sitting is insignificant. 3 years of sitting for 8, 9, 10 hours a day is a very different matter. Researchers found that sedentary behavior was associated with higher risks of all 4 major types of heart disease: atrial fibrillation, heart attacks, heart failure, and cardiovascular death, with a marked 40 to 60% greater risk of heart failure and cardiovascular death observed when sedentary behavior exceeded 10.6 hours a day. And what makes this finding genuinely alarming is that many of these negative effects persisted even among individuals who achieved the guideline-recommended 1 to 50 minutes of moderate to vigorous physical activity per week. In other words, you cannot simply cancel out 8 hours of sitting with a 1-hour workout, though exercise certainly helps. Now, the good news on this first pattern, and there is real good news here, is that the intervention required is surprisingly small. Older adults might be able to lower their blood pressure by reducing their sitting time by as little as 30 minutes per day, according to a 2024 study. A randomized clinical trial of adults aged 60 to 89 found that a 6-month sitting reduction intervention, where older adults reduced sedentary time by more than 30 minutes per day, measurably reduced systolic blood pressure. 30 minutes, not a gym membership, not a training program, just breaking up the sitting. The mechanism behind why that works is worth understanding. When you stand up and take even a short walk, your calf muscles contract. Those contractions squeeze the veins in your lower legs and actively push blood back up toward the heart. It is a biological pump that only works when you move, and after 60, it needs to be deliberately activated because the passive compensatory systems are no longer as reliable as they once were. So the practical takeaway from this first pattern is straightforward. Set a timer. Every 30 to 45 minutes, stand up. Walk to the kitchen, walk to the window. Do a few heel raises if you cannot go anywhere. The specific activity matters less than the interruption itself. Now, that brings me to the second sitting pattern, and this is where most people get genuinely surprised, because this one involves something that feels like it should be helping your heart, not hurting it. I'm talking about sitting in a deeply reclined position, the soft couch, the recliner chair, the posture where your hips are lower than your knees, your chest is angled back, and you are essentially halfway between sitting and lying down. A lot of people over 60 spend a significant portion of their day in exactly this position, especially in the evenings, and they do it because it feels comfortable. It feels like rest. And the assumption is that if it feels restful, it must be good for the cardiovascular system. The physiology tells a more complicated story. When you sit in a deeply slumped or reclined position, the diaphragm, your primary breathing muscle, gets compressed from below by the abdominal contents, which are now pressing upward because of the angle of your torso. Your chest wall cannot expand as fully as it can when you are upright. This means your breathing becomes slightly shallower, your oxygen exchange becomes slightly less efficient, and over the course of a 2 or 3 hour television session, your body is doing a quiet version of something it should not be doing for that long. Research has found that greater amounts of lying and reclining are associated with cardiovascular disease risk scores and several cardiovascular risk factors. This is separate from the risk associated with simple upright sitting, and it is a distinction that most people have never been told about. More time spent sitting, reclining, or lying down during the day may increase the risk of cardiovascular disease and death, according to a study in the Journal of the American College of Cardiology presented at the American Heart Association's scientific sessions. There is also a postural dimension here that directly affects blood pressure. When you are in a deeply reclined position, the normal hydrostatic relationships in your circulatory system shift. Blood volume redistributes. The heart has to recalibrate how much it is pumping and against what resistance. In a young, healthy cardiovascular system, this recalibration happens automatically and without consequence. After 60, when arterial compliance has decreased and the autonomic nervous system's ability to make rapid adjustments has slowed, these shifts create more variability. And variability in blood pressure over time is its own independent risk factor. The other thing happening in a deeply slumped posture is what I would call postural compression of the thoracic cavity. When your spine is curved forward and your chest is collapsed inward, think of the classic couch slump position. You are mechanically reducing the space available for your heart and lungs to function. This does not cause a cardiac event, but it does mean that every breath requires slightly more effort. Every heartbeat is working against slightly more resistance, and the cumulative effect of hours spent in that position, repeated across months and years, is not neutral. The practical correction here is also simple, but it requires a small shift in how you think about comfort. Reclined is not the same as rested. Your cardiovascular system is actually better supported when you are sitting upright with your feet flat on the floor, your hips at roughly a 90-degree angle, and your spine supported but not slumped. If you love your recliner, and I am not telling you to get rid of it, the key is to keep the angle moderate, not fully reclined, and to get up and move before you have been in that position for more than 45 minutes. Now, I mentioned at the beginning that there is a third sitting pattern, and that this is the one most people assume is safe. I want to keep that promise, because this is the one that concerns me most as a cardiologist, not because it is the most dramatic, but because it is the most invisible. It is the pattern of sitting completely still, in an otherwise normal position, with your legs crossed. And before you dismiss that as too small to matter, I want to walk you through exactly what is happening physiologically, because the mechanism is specific, and it is not what most people assume. When you cross your legs, one knee over the other, you are applying direct pressure to the popliteal fossa, the area behind the bent knee. Running through that area is the popliteal vein, one of the major vessels responsible for returning blood from the lower leg back up toward the heart. Sitting for too long can lead to compression of blood vessels around the hips and thighs, further restricting blood flow. When you cross your legs, you are adding a localized compression point on top of the already reduced venous return that comes with any prolonged sitting. Here is why this matters more after 60 than it did at 40. Blood pooling often points to an underlying issue with vein circulation, such as weakened vein valves that allow blood to flow backward instead of returning efficiently to the heart. In your 40s, your vein valves were likely strong enough that a few hours of crossed legs caused mild discomfort and nothing more. After 60, if those valves have lost even a modest degree of their competence, which is a completely normal part of vascular aging, then the combination of valve weakness, plus positional compression, plus reduced muscle pump activity, creates a situation where blood is genuinely struggling to get back to the heart efficiently. The downstream effect of this is not just leg swelling, though that is often the first visible sign. The effect is that the heart has less blood returning to it, which means it has to work harder to maintain adequate output. Cardiac output is not a fixed number. The heart adjusts constantly based on what is coming in. When venous return drops, the heart compensates by increasing its rate or the force of its contractions. In a healthy heart with good reserve, this is manageable. In a heart that has been dealing with years of mild hypertension or that has any degree of left ventricular stiffening, which is common after 60, this additional demand is not trivial. And here is the part of this that I think is genuinely underappreciated in most conversations about cardiovascular health after 60. Older adults typically sit between 65% and 80% of the time they are awake, and sitting is associated with health risks such as heart disease and diabetes. If you are sitting for the majority of your waking hours, which the data says most people over 60 are, and a significant portion of that time involves crossed legs, you are applying a venous compression that is essentially continuous. The heart is adapting to it. The vascular system is adapting to it. And the adaptation, over time, looks like what cardiologists describe as increased cardiac workload, reduced vascular efficiency, and the early structural changes that precede more serious cardiovascular events. There is one more dimension to this that I want to address before we close, because it connects everything we have talked about today, and it is the thing most people are not checking. Metabolism, glucose, muscle tone, bone, and the cardiovascular system are all affected by prolonged sitting. And yet, the monitoring most people do, a blood pressure check at the doctor's office, maybe a home reading in the morning, captures almost none of what is actually happening during the hours they spend seated. The blood pressure reading you get at 10 in the morning does not reflect what your cardiovascular system was doing during 4 hours of television the night before. It does not capture the venous pooling, the postural compression, the slightly elevated diastolic pressure that accumulated and then partially resolved by the time you woke up. What it does capture is the cumulative effect over months and years, and by the time that shows up in a clinical reading, the process has been underway for a long time. This is something medicine is not always good at communicating. We tend to give people advice based on population averages at a given age and then never revisit it. but the patient who comes in at 67 with mildly elevated blood pressure that appeared in the last 2 or 3 years, who is slightly more fatigued than expected, who has been sitting in the same recliner with their legs crossed for 4 hours every evening for the past decade, that patient deserves to have someone ask what is actually happening during those hours. If you found this useful, drop a comment below and tell me which of these 3 patterns you recognized in yourself. I read them, and the answers genuinely shape what I cover next. And if you know someone over 60 who spends a lot of time sitting, a parent, a spouse, a close friend, share this with them, not to alarm them, but because this is exactly the kind of information that tends not to come up in a 15-minute clinical appointment. There is a video I put together on what happens to your blood pressure while you sleep that connects directly to everything we covered today. The same cumulative, invisible patterns, just happening at night instead of during the day. It is worth watching back to back with this one. You will find it right here. So let us bring this back to where we started. There is a posture most people over 60 are spending hours in every day, and it is not doing what they think it is doing. The prolonged sitting without breaks is quietly elevating your blood pressure and reducing venous return. The deeply reclined slump is compressing your diaphragm and shifting blood pressure variability in a direction that matters over time. And the crossed leg habit, the one that feels the most harmless, is adding a specific, localized vascular compression on top of a system that, after 60, no longer has the same reserve to compensate without consequence. None of these things will cause a cardiac event tomorrow. That is not the point. The point is that the cardiovascular system does not respond to events, it responds to patterns. And the pattern that has been accumulating quietly, in your living room, in your favorite chair, in the position that always felt like rest, that pattern is worth changing, starting today.